Hello, my dear doctors. Welcome back. This is Dr. Azam here, your faculty of anatomy at PrepLadder. And today we are going to do this AMA session, that is Ask Me Anything session. And in this session, already I have received like many questions, many inquiries regarding anatomy from many of your students. So I'll first of all take up those questions, and then later on I'll also take up your questions. I'm also seeing in the chat box over there. So once we are done with all the questions that we have received from the students, then I'll even take up your questions, guys. Fine. A very good evening, Dr. Mehdi Abbas. Yeah, a very good evening, Dr. Amit. I'll let you know everything about that. Good evening, everyone. So let's get started with the session right now. Let's see what are the questions the people has been asked, and might be like whatever questions are going on in your mind right now, they might be already present over here. So let's see. Once we'll solve all these questions, then later on I'll even take your questions in the middle also. A very good evening, everyone. Fine. Now, first of all, moving on to the very first question here. Yes, my dear friends, what are the most important topics to focus in anatomy for INI-CET, and how to approach the anatomy for INI-CET from the PrepLadder resources? So basically, this question was only about the INI-CET, how to approach that one. Fine. Now remember, the most important topics to be learned for INI-CET, I would say that, comparatively, like not demeaning anything, comparatively between the INI-CET and NEET PG, INI-CET there is actually like a well organized exam. Why I'm telling you is it's always like very expected topics and very conceptual topics that will be asked. It's not like completely fact based or memorization based. Like good concepts will be actually asked from there. So if you want to like literally learn the most important topics for INI-CET, remember number one there will be the neuroanatomy, another one will be the head and neck, and then the embryology part. So these three you got to be like really perfect in this one. Why? Because I'll tell you a general notion also. The general thing is that the other topics like upper limb, lower limb, thorax, abdomen, pelvis, and perineum, almost every student will be learning. Even an average MBBS student will be learning. So if you want to decide to become a good doctor and an excellent doctor, so the difference here will be being an excellent doctor, you should be well aware about head and neck, neuroanatomy, and embryology for your PG exams. Okay, so if you're perfect with this one, of course you'll be able to solve many questions in the exam, and of course your ranking will be like more better, guys. Okay. Next, how to approach the anatomy for INI-CET from the PrepLadder resources. Of course, if you are actually a student who is going to start with the preparation, I would always advise you to start with all the videos, sir. Like all the full videos, the full content, because at least learn the subject once in your life. Okay. Now, once you are done with the subject once completely, of course, go for the rapid revision videos. Fine. That is always advisable for the students who are doing the proper preparation. Always learn the subject once, then only if you go for the revision, then you'll understand like more better. There'll be like more better chances of answering like clinical questions as well as like integrated questions that they are being asked nowadays in your exam. Now sir, what if you are at the last moment of preparation right now? Recently I have done a test and explanation session for INI-CET. Almost like 75 questions were there. Test and explanation session I have done for the INI-CET, like test and discussion. There was a test conducted in the afternoon time, and in the evening time I have taken the discussion. And they're like totally almost like 75 questions in that one, 70 to 75 questions in that. Questions in the sense, of course, you can understand I have completed almost like 70 to 75 concepts of anatomy, the very high yield concepts which are required for the exam. And of course, that will be including almost all the concepts itself. So if you go back and on the PrepLadder YouTube channel, if you watch that session, that will be very much helpful for your INI-CET preparation at the last moment. No, sir, I did not start the preparation from the very beginning. I just want to do something for the last moment. I think I have answered both the question. Apart from this test and discussion here, I am also going to come up with LRR session for INI-CET. And it is actually scheduled probably it is like scheduled in the November first week. So in the November first week I'll be doing the LRR session, or otherwise I'll try to reschedule that and try to do it in October also, based on my schedule. Why? Because if I'm doing in October, the students who are going to write down your INI-CET exam in the November, I think there'll be like ample time available for revisions also. So I'll try to do as much as best for possible for my students. Okay. So both the things are available. Like already available on YouTube is test and discussion session, and the upcoming will be the LRR session of the INI-CET. So please do attend that, and that will be helpful for your last moment preparation. Last moment preparation, guys. Okay. Acha. Now, before moving ahead to the next questions, before taking up the next questions, if you ask me, sir, just say me like one question. At least I want 1 mark definitely in the INI-CET exam. Definitely in the INI-CET exam, I want like 1 mark. So I would say that please learn the muscles of mastication. Muscles of mastication, guys. This topic is must and should. Very important one. Like they'll be definitely asking one question from here in every exam, in every INI-CET exam. I'm observing they are not getting tired of asking this question. So if you just say me, sir, just I want like 1 mark for sure, and 1 mark is going to change your thousands and thousands of ranks, you know that very well. The ranking will change. So if you just want like 1 mark, go for muscles of mastication. That is for sure question in your INI-CET exam. I can say that one. Next one, sir. Moving ahead. Explain the embryological derivatives of the heart. Now, certain questions I got regarding like general questions also. Apart from that, certain questions regarding the subject wise also. Yes. Yes, Dr. Avishkar and Dr. Pankaj Singh. For FMG also, yes, I have done a session on the YouTube there. You can go and watch. If you want the planning, you're just writing that for FMG karke. So for FMG, if you want the planning, on the YouTube session of PrepLadder, I have done one session with the name of, clear FMG exam in one attempt, something like this. Clear FMG exam in one go. So if you just watch that one, and that is, I have given you a 5-point strategy in that one, and that is going to help a lot for the FMG students to plan their all 19 subjects properly. Okay. So that is there, Dr. Pankaj Singh and Dr. Avishkar Mule. Fine. Now, moving ahead, the embryological derivatives of the heart. Yes, my dear friends, remember when we have learned embryology, I'll just tell you quickly in a couple of minutes. When we have learned embryology, there will be like ectoderm, and then you'll be having your endoderm. In the middle, we will be having mesoderm, and from there, the notochord is going to pass. Now, this mesoderm here will be actually divided to like paraxial mesoderm, intermediate mesoderm, and lateral plate mesoderm. And the first thing that you have to remember is that our heart is derived from the lateral plate mesoderm. To be very specific, it is splanchnopleuric. Splanchnopleuric. Now, this is what is actually the thing that I was telling you. If you watch the regular videos properly, then of course, my dear friends, remember all these things will be able to understand. Now suddenly, what is this like you're drawing ectoderm, endoderm, mesoderm? Where did this come this from? This is actually from your general embryology, the third week of general embryology. Fine. So heart formation is going to start from here, splanchnopleuric lateral plate mesoderm. And if you go and watch the videos of derivatives of heart, I have given you one simple diagram there, sir. On the cranial end, there will be truncus arteriosus. Then there will be like 3 dilatation: bulbus cordis, primitive atrium, primitive ventricle, and then finally the sinus venosus here. So this is truncus arteriosus, this is bulbus cordis, this is primitive ventricle, primitive atrium, and then there will be sinus venosus here. This one diagram, if you practice, you will get like all the derivatives of the heart from here itself. Okay, I'll just tell you 2 things here. For example, truncus arteriosus is the one which is going to form ascending aorta as well as the pulmonary trunk. And here itself, you have to learn that they are separated by a septum in the middle, and that septum will be the aorticopulmonary septum or spiral septum derived from neural crystals. Similarly, in the sinus venosus, there will be left horn, and left horn, a remnant of that one will be the coronary sinus. So something like this. Okay, and I'm just trying to tell you the glance of this one here so that you can get an idea and you can go and watch the entire video, because of course the video will be longer. It will be almost like 30 or 40 minutes of session to learn about derivatives of heart. The best way is this diagram, sir. In one diagram, everything will be completed. So I have shown you a couple of points here. The cranial part, that is truncus arteriosus, is the one which is going to form your ascending aorta in the pulmonary trunk, and the caudal part, the sinus venosus, is the one which is going to have left horn. Left horn is the one which is going to form your coronary sinus, something like that, sir. Fine. Next one, sir. And I said last month tips. Yeah, that's what I've told you. Last month tips. You can do the LRR session over there. And Gaurav Prashar is telling, sir, अभी मेरे बाल जैसे हैं आपके भी वैसे हैं. Very good. Like it's very nice. We are having the same hairstyle. But actually, I have been to some religious place and I've come back. That the condition is like that. लगता है सर नींद से उठे हैं. No, no, no. It's not like getting up from the sleep. I was actually taking an offline class in the Kerala. So I have just come back from there and I'm taking so might be my voice is looking a little bit tired because it was like long sessions, daily 12 hours of the sessions for almost continuously 5 days. Complete anatomy was done over there. That is the reason why. Okay. Next one, sir. Now explain the embryological derivative of heart. I told you here. Fine. Next one, sir. Now the next question that we are going to take up here, how to revise embryology and the neuroanatomy head and neck section in the faster way. The best way to revise the embryology and the neuroanatomy section is, see, in embryology, of course, we'll be approaching in the same manner. First, you got to learn about the general embryology, like first week, second week, and third week. And from the third week onwards, we'll be having systemic embryology. We'll be learning that systemic embryology. It's all about learning. And we have given like simple diagrams, very beautiful line diagrams. With the help of those line diagrams, you can actually learn embryology very easily. Now, in neuroanatomy, remember, when you follow the textbook order, that will be a problem for you. There'll be an issue following the textbook order, sir. Don't follow the textbook order. Follow all the videos in the same order that I have taught you in the PrepLadder app. That will be actually like very much easier for you to approach neuroanatomy in a very conceptual manner. Otherwise, it will be like really difficult, my dear friends. Okay. So first of all, in the PrepLadder app, if you see there, I have given you an introduction regarding the neuroanatomy where I taught you like about all the basic terminology of the brain, spinal cord. I started the videos from the scratch, from the basics we have started. Okay, now like central nervous system, peripheral nervous system, neuroglial cells, supporting cells, and all those things. So introduction is done. Now once you are done with the introduction, then go a little bit to the next standard. Then we are going to learn about spinal cord, sir. Spinal cord, of course, the external features and the internal, the transverse section of the spinal cord. Followed by the spinal cord, what you do is go for the brain stem. Then you learn about the brain stem. Okay. For example, if you follow this diagram, which I normally draw in our classes for a brain, so this is how your brain looks like, a schematic diagram of the brain and the spinal cord, sir. So always the approach should be from below here. So first learn the spinal cord topic here. After learning the spinal cord, then the midbrain and then the pons and then the medulla oblongata. These three together will be the brain stem, sir. These three together will be the brain stem. Fine. Now learn about the brainstem, everything, sir, like ventral aspect, dorsal aspect, the transverse section and everything. If you learn that one, that will be very much helpful to you, even learning the brainstem syndromes also. Fine. And definitely in your exams, one question will be coming from the brainstem. Definitely. Okay, now even whether it is your NEET PG exam or FMGE exam or INI-CET exam, one question will be definitely asked from the brainstem. Without a question from here, that topic will not be completed, sir. Then after that, you can actually learn cerebrum here. In the cerebrum, you actually have to learn about the white matter and the gray matter. The white matter and the gray matter, like association, commissural, projection fiber. And then along with that, the gray matter, the cerebral cortex and the basal ganglia, you got to learn about that one. And at last, you can go for cerebellum topic. In the cerebellum topic also, always they're asking like one question from here, like importantly that histological image of the cerebellar cortex, where you have all that 5 types of cells, the stellate, basket, Purkinje cell and all those things. And after that, later on, you can actually learn about the blood supply of the brain, that is circle of Willis and all the arteries and all. And finally, to end this, you can actually learn about the ventricles. Then you will understand the relations of that very well, sir. Is it okay? So in this manner, you're going to approach the neuroanatomy, guys. Neuroanatomy, you start from the scratch. You follow all the videos in order. That will be easier for you. First, spinal cord, then the brain stem, then the cerebrum, white and gray matter. Then go for the cerebellum, then the blood supply as well as the ventricles over there, guys. Okay. Next one, sir. What question bank of anatomy must be solved on the priority basis? Of course, the question bank which is given to you in the PrepLadder, if you solve that. Why? Because recently it has been completely revamped, and we have also done with the audio question bank, the latest feature that you can avail here, that is audio question bank, where all the faculties have recorded all the solutions of the questions in like respectively by the faculty himself. The question bank has been recorded, so you can just go watch that one. That will help you. Apart from that, just to check yourself, guys, you can actually do the custom modules as well as the PYQs. So whenever you're solving the question bank, remember along with the regular question bank that you have, the PYQs are very much important. Advisable will be the last 5 years. I would say that at least the 3 years, sir. At least the 3 years. And that too, nowadays it's not about the PYQs. We say PYT, sir, previous year topics. Previous year topics. That means if you are coming across in the previous year questions, suppose if there is an image based question about the neural tube, then you can go back to your notes, you can go back to your videos and revise the entire neural tube topics, like the entire thing, how the neural tube is forming, what is the cranial neuropore, the posterior neuropore, what are the anomalies associated with that one, and all those things in that manner. So at least bare minimum last 3 years PYTs are very much important. Previous year topics are very much important, sir. Hope this question is answered here. Explain the brain structure and anatomical parts together. I think I have shown you the diagram just now here. This is how the best way to learn about the parts of the brain. And this is there in the very first video of the neuroanatomy, in the introduction of neuroanatomy. So this is like sagittal section of the brain. And in the sagittal section of the brain, remember our brain will be divided into 3 parts here: the forebrain and the midbrain and the hindbrain. And my dear friends, this terminology, that is forebrain, midbrain, hindbrain, this terminology even school going students knows nowadays. So it's better you learn the medical terminology. Forebrain will be also known as prosencephalon, midbrain will be mesencephalon, and the hindbrain will be the rhombencephalon. Now this forebrain will be in turn divided into this big part that is nothing but your cerebrum. Okay. Cerebrum is also referred to as telencephalon, and located deep inside the telencephalon will be the diencephalon here, sir. And this diencephalon is actually made up of all the thalami parts. All the thalami parts together. Thalamus, hypothalamus, subthalamus, epithalamus, all the thalami parts together, they are going to form what's a diencephalon part here. Now, once you are done with that one, in the middle part, you'll be having your midbrain, and thank God midbrain is not divided. It's just simply midbrain. Now, hindbrain will actually consist of 3 parts. This thing in the front will be the pons, followed by the medulla. Behind the pons and medulla, this part here will be the cerebellum part. And all these 3 together are going to form your hindbrain. Remember, the pons and cerebellum together will be metencephalon, whereas medulla oblongata alone will be the myelencephalon, and that is going to continue down into the spinal cord. So that is how you have to actually learn about the structure of the brain and the anatomical parts together. Fine. I hope that was a question that you have asked me. Then the next thing is this big thing here, sir. Now you might be wondering that why sir has included like all the questions in one slide, which were asked by different students. Many students have asked about the syndromes of the brain. So in the brain, you'll be learning about that brainstem syndromes and all. So somehow all these questions are like, in and around these things only, like about the syndromes, about the stroke, which arteries will be involved and all those things. So remember, my dear friends, I have included all that questions in one slide itself to show you about all these brainstem syndromes and strokes at one place here. Fine. Now, the best way to approach this one here, the first thing is, don't get panicked by this diagram here. The best thing to approach here is, for example, if this one here will be the pons, and then followed by the pons, this one here will be the medulla oblongata, and then here, this one here will be the midbrain, sir. Midbrain, pons, and the medulla oblongata. Midbrain, pons, and medulla oblongata, sir. Now, what is going to happen here? There will be vertebral artery and vertebral artery coming from either side here. And both the vertebral arteries will combine together to form basilar artery, and that is going to finally divide it into the posterior cerebral artery, sir. So this one is the posterior cerebral artery, this one is the basilar artery here, and this one here will be the vertebral artery, sir. Fine. And the way I have drawn the diagram over there, you can clearly understand which artery is closer to which structure. For example, in this diagram, you're able to see here, there is posterior cerebral artery, which is nearer to midbrain. So if there is a stroke of that one, then it will lead towards midbrain syndromes. It will lead to midbrain syndrome, sir. Now this posterior cerebral artery is again divided into 2 parts here. The proximal part will be the P1 part and distal part will be the P2 part. And to be more specific, remember, in the midbrain syndromes, the proximal part, that is P1 part, will be involved. So P1 PCA will be involved in the midbrain syndromes. Done. If the basilar arteries, if there is a basilar artery stroke here, if there is a stroke in this basilar artery, then it will lead to pontine syndromes. Makes sense. And this is something important here. Vertebral artery will actually give rise to a branch here and a branch here, and both of them will combine together to form anterior spinal artery. Anterior spinal artery, from the name itself, you can understand it is supplying to which part? The anterior part of the spinal cord. Fine. Now, this anterior spinal artery, you can clearly see this artery is like more medial towards the medulla. They're giving the branch and both of them will combine together towards the medial side. So that is the artery which will be involved in the anterior spinal artery is the one which will be involved in the medial medullary syndromes. Okay. That is something important for your exams. In your exams, mostly they'll be asking you the medial medullary syndrome and the lateral medullary syndrome. So remember, medial medullary syndrome, the artery that will be involved will be anterior spinal artery. And another name for the medial medullary syndrome will be Dejerine syndrome. Similarly, the vertebral artery will actually give rise to a branch here, and that branch will be the PICA, posterior inferior cerebellar artery. Now, that is artery that will be actually involving into the lateral medullary syndrome. But my dear friends, please be very careful here. If this both the options are given in the exam, then remember the vertebral artery will be actually a better option when compared to the PICA. Vertebral artery will be a better option when compared to PICA for the lateral medullary syndrome, which is also referred to as the Wallenberg syndrome. So all the students who have asked me the questions regarding like which stroke, which artery stroke will occur in which syndrome and all, I hope that is solved in this one simple diagram here. And yes, of course, my dear friend, remember that this simple diagram I have already explained you in detail in the brainstem syndromes topic. You can go and watch the topic there, brainstem syndrome. It's a wonderful session, like one complete topic. In the very beginning, I told you about which arteries are involved in which strokes. Fine. Then apart from that, why I'm giving you this diagram here, sir? I have given you three diagrams here. This diagram is actually about the transverse section of midbrain, and this diagram is actually about the transverse section of the pons, and finally this diagram is actually the transverse section of the medulla oblongata, sir. So there'll be transverse section of the midbrain and the pons and the medulla oblongata. Fine. Now you might be wondering that there are like so many structures present inside this one. Of course, my dear friend, inside the midbrain, first of all, what will happen here? We will be having aqueduct, and from the aqueduct, we are going to divide that into three parts there. The part behind tectum, the part in the middle tegmentum, then you'll be having cerebral peduncle. Then behind here, there will be the colliculi, two superior colliculi, two inferior colliculi. And then in the front, there will be the gray matter, substantia nigra. And this white matter here will be the crus cerebri. Okay. And this one here will be the red nucleus. Similarly, this one will be the lemnisci. Now, the problem here is that listen to me very carefully, my dear friends. What is the problem? The problem here is that the moment there will be like brainstem syndromes topic, every student knows that it is very much important, very much important. Now, why these many questions, these many people have asked the same question here? These many students, they have asked the same question about the brainstem syndromes and all. Why? Because approach. The problem is with the approach, and the problem is with the impatience actually. Approach, what I'm trying to tell you here. Why? Because brainstem syndrome बहुत important topic है. चलो directly वही video open करते हैं और पढ़ते हैं. So students will directly jump to that brainstem syndromes video and open that one, and they'll start studying, and they will not get lost with all these things. So what the hell is this one? Like, where are this lemnisci coming from? Where is that colliculi? Where is that substantia nigra and all? My dear friends, remember, it is actually slowly built. This diagram is like the final diagram. It's slowly built. I mean to say, the transverse section of midbrain, the entire transverse section of midbrain here, I will be actually teaching in the brainstem topic. I told you, right, after spinal cord, brainstem. Then later on, this lemnisci will be studying in the tracts, ascending tracts. The ascending tracts will continue up into the lemnisci. And after that, the corticospinal tract we have actually learned in the descending tracts. Okay, the descending tracts here. So what I am trying to tell you here is that all the structures that you are able to see here, one structure that has been dealt in different topics. Similarly, if you look at the transverse section of the pons over here, yes, the sixth nucleus, the seventh nucleus, the sixth, seventh, and eighth nerve coming out from the pontomedullary junction, all that we have discussed in a separate topic. Similarly, in the medulla here, you can clearly see there will be a pyramid here, there will be an elevation olive there. Between them, the 12th nerve is coming. So what I'm trying to tell you is that please, my dear friends, please follow my advice very carefully here. ब्रेनस्टेम सिंड्रोम्स बहुत इंपॉर्टेंट है आपके लिए, एग्जाम के लिए पढ़ना बहुत जरूरी है, बट द प्रॉब्लम इज डोंट जंप टू दैट टॉपिक. Have some patience, follow all the videos of the neuroanatomy in sequence, and then only this is going to help you. Otherwise, you will never be able to learn in the lifetime. I'm telling you. Okay. So please remember these diagrams that I'm showing you here that I have taken in the brainstem syndromes video. And in one diagram, I have beautifully given you all the syndromes at one place without confusing you much. For example, if you see this only one diagram of the midbrain, you will be able to learn Weber's syndrome here, Benedict syndrome, and the North-Nagel syndrome, the Perinaud syndrome, and you know very well there is one more syndrome known as Claude syndrome. That is nothing but the Benedict plus the North-Nagel syndrome. So all syndromes will be completed in one diagram. Similarly, in the pons also, the medial medullary, on the medial side, there'll be the Millard-Gubler syndrome, and on the lateral side, we'll be having the pontocerebellar angle syndrome. And in the medulla, you'll be having the medial medullary and the lateral medullary. So in one diagram, all the syndromes are done in a very perfect manner so that there should be no confusion to my students. But the only one condition, the only one request that I can make to you people is that please learn this after completing all those basic topics, because every part that you're able to see here is covered in some of the other topics here. So once you learn all that in sequence, then only you'll be able to understand. So that answer your questions there about the brainstem syndromes, how to approach the topic. This is how you have to actually approach the topic, sir. Perfect. Next one, sir. Explain the lower limb nerve supply, and similarly explain the muscles of the lower limb here. See, when you follow my classes of anatomy on PrepLadder, upper limb and lower limb, there is approach, sir. Upper limb and the lower limb, there is a proper approach. See how we are going to approach that one. I think the students who have attended my offline classes as well as the online videos there, they know that very well. There will be one golden rule I'll be giving them. In that golden rule, my dear friends, in upper limb, arm, forearm and hand. In the arm, there will be anterior compartment and posterior compartment. In the forearm, there will be anterior compartment of muscle and posterior compartment. Similarly, in the hand, if you touch here, there will be no muscles behind. The muscles are only present in the front here, muscles of hand. Now, the golden rule here is that all the muscles in anterior compartment of the arm will be supplied by musculocutaneous nerve. Posterior compartment of the arm supplied by radial nerve. Similarly, the posterior compartment of forearm is supplied by radial nerve, sir. Whereas the anterior compartment of the forearm is supplied by ulnar and median, and the same ulnar and the same median nerve will also continue in the hand also. So if you remember this, the things will become a little bit easier for you, sir. Even learning the entire course, learning about the nerve supply to muscle. For example, I just give one example here. Just now I told you that all the muscles in the arm, anterior compartment of the arm, are supplied by musculocutaneous nerve. Now you can easily remember biceps muscle is supplied by musculocutaneous nerve. Triceps will be supplied by a radial nerve, something like that. Okay. Similarly, someone has asked the question regarding the lower limb. In the lower limb also the same golden rule I have made there. You can go back and see there. In the thigh, all the muscles are divided into three compartments: anterior, posterior, and the medial compartment. In the leg region, there will be like three compartments: anterior, posterior, and the lateral compartment. And in the muscles of foot, they are simply like no compartments, they are muscles of foot. Now, in the anterior compartment of thigh, all the muscles are supplied by femoral nerve. Medial compartment of the thigh, all the muscles are supplied by obturator nerve. And in the posterior compartment of thigh, there will be sciatic, which is in turn having two components, that is tibial and common peroneal nerve. In the leg region, posterior compartment, that is calf muscle, will be supplied by tibial nerve. Anterior compartment is supplied by deep peroneal nerve, and lateral compartment will be supplied by superficial peroneal nerve. And finally, in the muscles of foot, it will be taken care by the medial plantar nerve and the lateral plantar nerve. Understanding? So for both upper limb and the lower limb, you are going to approach exactly in the same manner. Follow my golden rule, and that is going to help you a lot, sir. That's all. So whoever has asked this question, I hope I have solved your query there. How to learn all that nerves in the lower limb? The best approach will be following with the compartments and the respective nerve supply. And that will make your life easy in upper limb as well as the lower limb, sir. Now moving ahead, what is the anatomical basis of the foot drop? In foot drop, the nerve which will be involved will be the common peroneal nerve. And that is more better answer when compared to the deep peroneal nerve, sir. Actually, what happens is, what is the anatomical basis? Common peroneal nerve will be dividing into like two branches here. Of course, the superficial peroneal nerve and deep peroneal nerve. And as I told you just now, deep peroneal nerve will be supplying to all the muscles present in anterior compartment of leg. Deep peroneal nerve will be supplying to all the muscles present in anterior compartment of the leg. And in that anterior compartment of the leg, you'll be having extensor hallucis longus, extensor digitorum longus, and then of course it is anterior compartment, so you also have tibialis anterior muscle there. Even recently asked in the exam, there will be one more muscle here, that is peroneus tertius. And they have asked what is the nerve supply of this peroneus tertius. Remember, the answer is deep peroneal nerve. That was recently asked in the exam, sir. Now, out of this muscle, remember, extensor hallucis longus, extensor digitorum longus, these are helping in dorsiflexion of the foot. They are going to, help in dorsiflexion of the foot. Now, if these extensors are lost, if they are gone, of course, your foot cannot be dorsiflexed, it will be dropped. That condition is referred to as foot drop. So that is a that is the approach here. But of course, theoretically, you might be thinking that, okay, deep peroneal nerve is gone, then it will be leading towards a foot drop. If this is gone, it will lead to what? Foot drop. Fine. But remember, the name itself is telling you it is like deep peroneal nerve, deeply located. So in clinical conditions, it is not most commonly injured. Most commonly, the common peroneal nerve will be injured, which is going to take a turn near the neck of fibula. And it is very much superficial over there, and it is commonly injured there. So that is the reason why I'm telling you, if they're asking you which nerve will be involved in foot drop, the better answer will be the common peroneal nerve when compared to the deep peroneal nerve, sir. Next one. How to study neuroanatomy? I think just now I told you in detail. In detail approach will be, yes, start from below. The spinal cord, the brain stem, the gray matter, the white matter, then the cerebellum. I told you just now about the neuroanatomy in detail, how to learn. Previously, the question has been asked. How to make the last minute concise notes containing all high yield topics with most important points. Now, this question, I liked it a lot. Now, how to make the high yield topics as well as the most important points. I'll tell you one approach here, sir. The approach that I'm seeing nowadays when I'm meeting with like many students is that, for example, today I have completed neuroanatomy. Okay, today I have completed neuroanatomy. I mean to say, if you're attending offline class, in the whole day, in one day I have completed neuroanatomy. Or suppose if you are watching my PrepLadder videos at your home, so today you have completed all the videos of neuroanatomy. Now, after that, completing all the videos, you have watched all the videos. Now you're going to solve the MCQs. You're solving the questions. Now, our students, the approach, the mindset that has to be there. So, the first thing that you should have in your mind is that the first thing that you have to have in your mind, sir. I'll tell you two things here. Please remember carefully. The first thing is that many students will think that attending the lecture or just watching the videos is the preparation. My dear friend, remember, solving the questions is also a type of preparation for your exam. In fact, that is more important. Why? Why? Because at the end, you are going to attempt the exam, and that exam is actually MCQ based. So you have to train your mind to solve the questions only, right? They are not asking, like, it's not like a prof exam. No, when you're appearing for INI-CET, NEET PG or FMGE exam, it's not like a prof exam where you're going to write down all the long answer, short answer and all. No. So the theory, okay, that is for understanding, but solving questions is very much important. So please, from today onwards, change your mindset. Sir, I'm not getting time to solve questions. Many of the students, out of phobia, they will not solve questions. Just keep the note in the front, and they'll be like conventionally the same old method. They'll be like, mugging up the notes only. No, you have to train your brain how to see the question, and after seeing the question, the four option, how your mind is functioning, how it is eliminating the wrong option, how you are selecting the right option. That training is must and should. Okay, first point. Second point is that now some students will have, out of all that courage, they'll finally start solving the question. Now in neuroanatomy, after completing that, suppose you have solved like 10 MCQs there. Out of the 10 MCQs, you were able to solve like, for example, 7, and 3 MCQs were a little bit tricky. Okay, you were not able to solve, or it was not covered in the notes, something like that. Okay, now the students thinking now is that, khatam. They will be like so much discouraged if they are not able to solve like 3 to 4 questions. They're like so much discouraged that, okay, I'm not fit to do MBBS, I'm not fit to study medical sciences. They will decide something like that in the life. Entire life they're deciding based on that four questions. Please don't do that. Please don't do that. What should be the right approach? Okay, solving questions. Yes, sir said that that is also a type of preparation. 7 questions I knew very well. 7 क्वेश्चन मुझे बहुत अच्छे से आते थे. That is done. 3 questions I don't know. Try to read the explanation. Or else if you're not able to understand by reading the explanation, listen to our audio question bank. The faculty themselves has explained. I have explained in the audio question bank. Try to understand. You will be able to understand that one. And because you are not able to solve that question, that was wrong. So pick up that one now and please add to your notes, sir. This is a golden thing that you have to do. Pick up that question, pick up that point, pick up that line and add to your notes in the respective topic. And once you add that in your notes there, now my dear friends, remember that your notes are like golden notes right now. Why? Because you already have those 7 questions which you knew in that one, and you also have the 3 questions which you were not able to solve. So जो आपको आता था वो भी है, जो नहीं आता था वो भी रहेगा वहां पर. Understood? So whatever you know is there in your notes already, which you are able to solve the question, which is not there, add that to them. If you do this practice, I'm telling you, my dear friends, your notes are going to become like golden notes. Just keep on revising that multiple times, and then you are ready like a pro for the exam. So please change your mindset. When I'm meeting with many students, the mindset is a problem. Mindset is like, sir, how to solve MCQs, where to solve MCQs, I don't have time, I'm having fear. ये सारे बहाने छोड़ दीजिए. MCQs ही solve करना बहुत important है. Final exam is all about the MCQs only. So train your brain for that one. कैसे प्रिपेयर करें अपने आप को, मैंने आपको तरीका बताया है. जो पता है वो भी होना चाहिए किताब में, और जो नहीं पता है वो भी आपकी किताब में होना चाहिए. तो पिकअप करिए और ऐड करते जाइए. दैट इज द वे हाउ यू गोइंग टू प्रिपेयर फॉर योर एग्जाम्स. Is it okay? So please remember these 2 things, and that is why I told you I like this question a lot. That will be having all the important points with all the high yield topics in your notes. That is how you have to make your notes for the last moment. Is it okay? So it's not about just highlighting or something like that, sir. Make your notes like this for the last moment. Okay. What is the systematic approach to study anatomy of the abdomen? Abdomen में सबसे पहले the best way to learn is first learn about the abdominal wall. Start from outside, learn about the abdominal wall. In that you have to learn about the anterior abdominal wall and posterior. Out of that, anterior is extremely important. Extremely important. Why? Because that is the one which will be having almost all the concepts there. The deep inguinal ring, superficial inguinal ring, inguinal canal, rectus sheath, inguinal hernia, Hasselback's triangle, spermatic cord, descent of testis, almost everything, yes, in the anterior abdominal wall. So definitely there'll be a question coming directly and indirectly in your exam, sir. यहाँ से एक सवाल हमेशा आता है, and yes, some students are the FMG students who are listening to me here. In FMG, definitely there'll be always one question regarding inguinal hernia. Inguinal hernia, तो anterior abdominal wall पढ़ना जरूरी है. Now once you are done with the anterior abdominal wall, then you enter inside the abdomen. And inside the abdomen, you have to learn about all the visceral organs, but that is not that much important nowadays, sir. We are seeing the pattern of question paper. They're not asking much questions about the viscera and all. Sometimes here and there, they'll be asking about the relations of some, organs. And those will be covering like kidney, the relations of kidney, and about the liver, the Connaught's classification of the liver. I have completed that or covered that in detail in the videos. So few organs here and there, they will be asking you the relation. Otherwise, viscera, not that much important nowadays. Why? Because they're asking all clinical questions and all. Apart from that, then your approach should be like blood vessels. Try to do all the blood vessels at one place, like all your entire arterial system and the venous system. Start from the abdominal aorta. Abdominal aorta will give like one branch in the front. That will, 3 branches in the front. That is celiac trunk, superior mesenteric artery, and inferior mesenteric artery, supplying to your gut. Learn them. That will be completing the entire arterial system. तो कहाँ से स्टार्ट करना चाहिए? Abdominal aorta, then go for the celiac trunk, then superior mesenteric artery and inferior mesenteric artery. And in the venous system, you have to learn about 2 systems here. One is portal vein, another one is inferior vena cava, and they are going to join at certain places known as portocaval anastomosis. This should be your approach here, and of course the abdomen topic will become easy for you. And then don't forget about the peritoneum, all the peritoneal folds. In this peritoneal force, if you ask me, sir, one question which can be asked in the exam, that is about the boundaries of epiploic foramen. That is a trending question nowadays. The boundaries of epiploic foramen, a trending question nowadays in the exam, so they're asking like many times. Fine. Yes, Dr. Kartikeya, omphalocele and gastroschisis, we have discussed about this one in the embryology part, gut embryology, where we learn about the rotation of midgut and all. Fine. And list the key steps to use GTs effectively in the daily study routine. Remember, GTs, my dear friend, GTs, the best thing that you have to do is, I will always say every time say, and I'll keep on saying this many times. Remember, it is not about just giving GTs, it is about the post GT analysis. Post grand test analysis is very much important. You write a GT, then after that, how many ever questions were wrong in that one, you should spend more time in that one. Please remember that it's not about just giving the exam, and after the exam, don't be like, the students will be either in two situations, sir. The one who got the good marks, जिसको अच्छे marks आए हैं, that student will be like, oh, I'm done, I'm like happy, मैं तो exam clear कर दूंगा ऐसे. The student who got less marks in GT, not able to score, he'll be like very sad. No need to be sad, no need to be happy, just maintain your equilibrium there, just be calm. Even if you got like very good marks in GT, hardly like might be your 10 or 20 questions were wrong, you should be keen enough to sit down after the exam and see all the 10 questions. What was the wrong thing? What was the wrong thing in that one? Were you not able to recall in the exam? Or did you like completely omitted the topic? You did not study the topic at all. आपने पढ़ा था लेकिन एग्जाम में याद नहीं आया, या फिर आपने क्वेश्चन रीड करने में कुछ गलती कर दिया, आपने छोड़ दिया एक्सेप्ट एंड ऑल दोस थिंग्स. तो ट्राई टू एनालाइज व्हाट इज द प्रॉब्लम करके एंड ट्राई टू सॉल्व, एंड दैट इज गोइंग टू इंक्रीज योर स्कोर फर्दर इन द अपकमिंग जीटीज. ओके, तो जीटीज के लिए ये सवाल जिसने भी पूछा है, whoever asked this question, sir, please remember it's mainly about the post grand test analysis that is important, and that is the one which is going to increase your scope of marks in the upcoming GTs. अरे यार, कॉमन सेंस से सोचो ना, अगर आपके जो गलतियां हैं अगर आप उसको रेक्टिफाई नहीं करोगे तो अगले जीटी में स्कोर बढ़ेगा कैसे? हाउ इट इज गोइंग टू इंक्रीज? तो आई एम जस्ट ट्राइंग टू टेल यू दैट एनालिसिस करोगे, बैठोगे और देखोगे कि टॉपिक में दिक्कत कहाँ है, व्हाट इज द प्रॉब्लम, कि मैंने टॉपिक पढ़ा ही नहीं है या फिर पढ़ा था याद नहीं आया, आप उसको दोबारा रिवाइज करोगे तभी तो आपका स्कोर बढ़ेगा, राइट? तो जीटीस के लिए एक ही एक फंडा है, इसके अलावा कुछ और नहीं है. देयर इज नो अदर फंडा इन दैट वन. The funda how to increase the marks in GTs post grand test analysis. Is it okay? And then moving ahead, please explain brachial plexus. Brachial plexus we have completed in detail in the I should say in our upper limb topic. The very first topic is brachial plexus only, and it's like quite easy. Don't try to go ahead with that complicated diagram in textbook, you will go mad. You follow my simple diagram. Brachial plexus is going to begin from C5, C6, C7, C8 and T1. यहाँ देखो sir, in less than 1 minute we can make this diagram if you attend my class. C5 and C6 will combine to form upper trunk, C7 middle trunk, C8 and T1 will combine to form the lower trunk. And all these three trunks will be dividing into two divisions. One will be the anterior division, another one is posterior division. If you join the posterior divisions together it is going to form the posterior cord. And then the anterior division of upper trunk and the middle trunk will combine to form lateral cord, and then the lower trunk will continue as medial cord here. That's all done. Lateral cord will give you 3 branches, remember, with the mnemonic as LML. Medial cord will give you 5 branches with M4U, and remember the posterior cord will give you 5 branches, remember, with the mnemonic as lunar. Lunar, sir. Understanding, my dear friends? So in this manner brachial plexus is done. So whatever the final conclusion I have showed you here in less than 1 minute, of course you can also become the expert in that one. Just go and watch the brachial plexus topic in upper limb, and you are going to make this in less than 1 minute, sir. Okay, 1 मिनट से नीचे में आप ऐसे बना सकते हो. एंड इंग्लिश तो अपने को आती है, अंग्रेजी तो आती है, इसी को अगर आप आराम से अगर लिख दोगे तो आई होप दैट विल बी हेल्पिंग यू इन योर प्रॉफ एग्जाम. आई एम अज्यूमिंग दैट दिस क्वेश्चन इज आस्क्ड बाय सम ऑफ द स्टूडेंट हु आर प्रिपेयरिंग फॉर योर फर्स्ट ईयर प्रॉफ एग्जाम्स. So my dear friend, remember, brachial plexus is very easy to remember. Fine. So by this, my dear friend, remember, like all the questions that has been asked, I have completed here. I think it was a very good session. Like it was a nice session. Why? Because this I have actually done for the very first time here on the PrepLadder YouTube channel. Ask Me Anything session, and I liked it. Why? Because here I'm able to know what is the pulse of the student, like what is the main problem happening in the entire anatomy, what is the exact areas where you're getting the problems, and we are actually able to tell you how to approach the subject instead of just teaching the topic. How to approach that is important. Fine. Yes, of course. So by this, my dear friends, all the questions are done for this session here. I hope whoever students have actually dropped this question, all their queries has been solved, and even I have taken the questions from your chat box here. So I think that is all done now. Dr. Suman is asking, sir, please cover the larynx. Larynx is done in detail in the video, Suman. You can just go and watch the larynx there. First, you have to learn about the cartilages, then learn about the muscles. Muscles and their action I have taught you very clearly with simple line diagrams. Simple line diagrams I've given you so that you can understand adductor, abductor of the vocal cords, opening and closing of the inlet of the larynx, increasing and decreasing tension in the vocal cord of the larynx. So that will be done easily. Fine. So that's all for this session, my dear friends. It was nice interacting with you. Study well, keep on learning. Okay. And yes, of course, you will come out with the flying colors. I'll pray for you. You keep on doing the hard work. God bless you with lots and lots of success in your future endeavors. हम लोग हमेशा हमेशा आपके लिए दुआ करेंगे. Take care. All the best. Thank you.